Breaking news, and seniors across America need to hear this immediately. A brand new Social Security order from Donald Trump just kicked in today, and experts warn this could reshape how millions of older Americans qualify for benefits, especially disability benefits. We're talking about changes that could tighten eligibility, redefine what counts as work capability, and put older workers in the same category as young applicants for the first time in decades. This isn't a proposal. This isn't a rumor. This new rule just became active today. And the impact? It could be huge. What just happened today? Here's what launched today. The Social Security Administration has activated a new rule pushed during Trump's first term, but delayed for years, that changes how disability eligibility is determined for seniors aged 50-60. For decades, Social Security rules gave older workers a slightly easier path to disability approval, because everyone knows if you've spent your life in mining, construction, trucking, farming, in warehouses, or heavy labor, shifting to a computer job at age 58 is nearly impossible. But starting today, age will no longer be the protective factor it once was. Under the new rule, a 55-year-old in chronic pain is evaluated almost exactly like a 25-year-old. And the SSA can now deny benefits if they decide there might be a lower stress job available, even if it's unrealistic for the worker. Meet Christopher Tinker, 55 years old, Arkansas. A lifetime of hard work, coal mines, Walmart, long-distance trucking, wastewater jobs. He worked until he physically couldn't anymore. He lost one leg, and doctors say he may lose the other. The only thing keeping him stable was disability benefits, benefits he earned over a lifetime. Under the old system, his age helped him qualify. Under the new rule starting today, his age no longer counts. He would be evaluated the same as a young applicant with zero work history, and the SSA could point to a list of modern, computer-based jobs and say, look, these exist, you could do one. Even if he's never worked on a computer a single day in his life, even if he has no remaining mobility. Why this is happening, the hidden push behind the rule. This rule didn't appear out of nowhere. It actually began during Trump's first term, created by officials inside the SSA and pushed by figures connected to Project 2025. When Trump left office, the rule stalled. This year, it came back to life, fast. And today, it officially takes effect. Supporters claim it will remove loopholes and reduce fraud, but disability advocates say it does the opposite. It removes vital protections from older workers who spent decades in hard labor. The updated job list, the silent change. No one noticed for decades, Social Security disability decisions were based on an ancient job list created in 1977, a time when the world had no internet, no smartphones, no automation, and barely any office computers. That outdated list included jobs that literally don't exist anymore, like microfilm operators, nut sorters, and hand sewers. Yet millions of disability claims were judged using these irrelevant job descriptions. Today, that system has quietly been replaced with a brand new modern job list, and the changes are far bigger than most people realize. The new list heavily favors modern digital roles, remote desk work, data entry, computer monitoring, call center responsibilities, basic administrative tasks, and even gig economy jobs like rideshare driving or delivery apps. Without any public spotlight, this update completely reshapes who gets approved and who gets denied. Why this change is so controversial? Here's the problem. While these new jobs sound simple on paper, most older workers, especially those with physical injuries or outdated skills, have zero training for them. Yet the SSA will now assume they can perform these jobs unless proven otherwise. That means a 58-year-old factory worker with severe back pain, a former truck driver with nerve damage, or a retired coal miner who has never touched a computer may suddenly be told, you're not disabled, you can do a remote computer job. Even if they don't own a computer, even if they can't type, even if they live in a rural area with no internet. This rule, effective today, could quietly lead to thousands of denials, all based on jobs people have never done, never trained for, and realistically cannot perform. And yet, most Americans have no idea this shift even happened. Who will be affected the most? This change will hit the hardest in states where disability reliance is already at its peak. Places like West Virginia, Arkansas, Kentucky, Mississippi, and Alabama, where thousands of people depend on benefits just to stay afloat. These aren't big coastal cities with access to endless resources. These are rural communities, small towns, mining regions, and agricultural counties where jobs are physically demanding and medical care is often miles and away. They are overwhelmingly working-class Americans, many of whom spent decades doing hard labor, only to be sidelined by injuries, chronic illness, or age-related disabilities. And here's the political reality. These areas are also some of the strongest Trump-supporting regions in the entire country. Ironically, the very people who backed him the most, older workers with worn-down bodies, former factory employees, coal miners, farmers, truck drivers, are statistically the most likely to face new denials or reevaluations under this updated system. For many families, this shift could mean tighter budgets, delayed medical care, and a sudden wave of uncertainty about their monthly income. Starting today, the Social Security approval system shifts into a much tougher, faster, and more restrictive model, and millions of Americans will feel the impact immediately. The first major change is that age is no longer a strong advantage in the approval process. For decades, older workers, especially those over 50, had a smoother path to benefits because the system recognized they couldn't easily switch careers or adapt to new physical demands. That protection is now weakened. Claims for people ages 50 to 60, especially those coming from construction, factory work, transportation, and other heavy labor jobs, are being flagged for reevaluation. Many of these workers could lose the weight age once held in their favor, putting long-time manual workers at a sudden disadvantage. What changes today for applicants and current recipients? Full breakdown. On top of that, experts are warning that denial rates may spike because of the new job matching rules. Under these rules, if Social Security believes any job exists anywhere in the national economy that you could theoretically perform, even outdated, unrealistic, low availability, or across the country, they can use it as justification to deny your claim. These strict standards are expected to hit red states the hardest, because those states have the largest populations of aging, manual labor workers with physically demanding job histories. In other words, the very people who relied on disability protections the most may now face the highest risk of being denied. Advocates say this marks one of the biggest shifts in SSA decision-making in over 40 years. How many people could lose eligibility? According to expert projections from researchers analyzing this rule, as many as 1.5 million Americans could lose eligibility over the next decade, not because they're not disabled, not because anything changed in their health, but because the rules around how they're evaluated just changed. Why critics say this is dangerous. Critics warn this rule punishes older workers, forces injured people into unrealistic jobs, ignores medical vulnerability, overlooks decades of physical labor, pushes disabled workers into poverty, and creates a massive backlog for appeals. For many advocates, this is considered one of the most significant Social Security changes in years, and today is the first day it goes active. What seniors should do right now. Starting today, every senior SSI recipient and SSDI beneficiary needs to take action immediately. Begin by double-checking the current status of your disability or retirement claim inside your SSA online account, even if you think everything is fine. Next, gather every piece of workplace and medical documentation you have, including older reports, medication lists, test results, and treatment summaries. Make sure to save every letter, notice, or update the SSA sends you, because these documents become crucial during reevaluations. Prepare for the possibility of new medical reviews and contact your doctor now to request updated medical notes so you're not caught off guard if the SSA requires fresh evidence. And if your claim is denied or delayed at any stage, file an appeal immediately. Waiting can cause you to lose benefits or fall behind. This new rule impacts millions of seniors nationwide, but staying organized, proactive, and informed is your best protection. Listen, Social Security changes aren't just confusing. They're life-changing. And today's new rule isn't a rumor, it isn't a proposal. It's active, real, and already affecting seniors, disabled workers, and millions who rely on benefits to survive. That's why staying informed isn't optional anymore. It's protection. I'm following every update, every reversal, every vote in Congress, and every policy shift the moment it hits the system. And the second anything changes, whether it helps you or hurts you, I'll break it down instantly so you're never caught off guard. So do yourself a favor, hit subscribe, turn on the notification bell, stay ahead of the decisions that could impact your income, your disability status, and your entire retirement future. Now, I really want to hear from you. Do you think Social Security disability rules should be stricter, or should they be more protective for older workers? Drop your thoughts in the comments. I read every single one. This video is for informational purposes only. It is not legal, financial, or professional advice. Social Security policies are subject to federal interpretation and may change. Always consult the SSA or an official representative for the most accurate, up-to-date guidance.